We now look how to clean the device. Although only the disposable spacer comes into direct contact with the wound, the device should be disinfected regularly. A superficial wipe disinfection should be done after each treatment. The plasma source should only be cleaned if there is a visible contamination. A more intensive cleaning of the unit and the plasma source is recommended at least once a month. Ideally, cleaning should be done at the end of a working day so that the components can dry overnight. Only disinfection wipes approved for the cleaning of medical devices should be used. Please don't use any spray disinfection, and non-fuzzy wipes are indispensable. The plasma source can be removed in order to clean the device, but this requires a bit of sensitivity. Turn the plasma source to the left and pull it off gently. Note: please do not try to pull off the plasma source in any way by using force. Next, we will see how to clean the plasma source itself. The plasma source is the heart of the plasma care device, where plasma is generated by means of microdischarge. It contains an extremely thin ceramic plate with sensitive electrical contacts, so for cleaning some rules have to be considered. First of all, wipe the plasma source on the back side. Now turn it around and clean the electrode grid side. In this case, rule number 1 becomes relevant. The grid side may only be dabbed in order to prevent that lint is stuck to the plasma source. Lint residues would influence the quality of the generated plasma and could cause a long-term defect of the plasma source. Rule 2. Do not reattach the plasma source to the device directly after disinfection. The device must dry for at least 1 hour, preferably overnight. If a plasma source is not completely dry, it may cause unrepairable damage to the device. After drying, reattach the plasma source to the device. Please make sure that the cutouts on the plasma source and the lashes on the device head fit into each other. Then you can screw the plasma source on again easily without resistance by turning it to the right. If you have to use force for this, it is a sign that cutouts and lashes are not correctly placed on each other. If you have any further questions, please do not hesitate to contact us. You may contact us via email at info@terraplasma-medical.com.